So let's start with trigger point therapy using your tennis ball. So let's go find an empty space along the wall somewhere. And we're going to place the tennis ball in between your shoulder blades up high on your back. Okay? Then you're going to lean back against the wall with the tennis ball in between your shoulder blades, but off of the spine. So we're not going to be on the spine at all. We're focusing on muscular areas of your body, okay? So not on the spine. And we're just going to start by rolling around in that upper back area and just massaging some of those tight, sore muscles in between the shoulder blades. Okay, so again, we're not crossing over the spine here. We're just staying off to one side of the spine. Okay, and you can pick a sore spot that you came across here and then just apply gentle pressure into that spot. That sore spot is usually a trigger point, and by applying pressure for about 30 seconds, it sends a signal to the brain to shut down the chronic contraction. So there's a muscle receptor that senses the pressure from the tennis ball, and that helps to shut down any chronic contraction. So that'll relieve tension, maybe discomfort that you might be feeling. So now let's switch over to the other side of the spine. Okay, so same area, we're just moving over to the other side, and same thing, we're just going to roll around, warm up the area, increase circulation, and this is going to help to reduce any inflammation present in the muscle as well. Okay, so let's go ahead and pick another sore spot here and apply pressure for about 30 seconds here. And as you're applying pressure, you want to really relax that muscle that you're working on. Take a few deep breaths in and out, relaxing that muscle, and almost thinking that you want to allow the muscle to wrap around the shape of the tennis ball back there. Okay, so really relaxing the arms down beside your body, taking a few deep breaths, and again, it's about 30 seconds or so that you want to hold on that spot. Okay, so now we're going to move on to the chest. So let's take the ball in the right hand and we'll cross over to the left side of the chest. And we're going to roll around in this upper chest muscle here. And again, just looking for any sore spots that you're coming across. Increasing circulation again, decreasing any inflammation. And then let's go ahead and pick a sore spot and hold there for about 30 seconds. You can apply pressure with one hand or with two hands. If the pressure is too much and you're feeling that it's really uncomfortable or painful, then just decrease the pressure. You might just be pressing too hard and you don't want to do that. You can hurt yourself if you're pressing too hard with this. So it's sort of gentle and yet firm pressure, okay? So it might be a little bit uncomfortable. That's okay, but it should not be painful, okay? Let's switch to the other side. Again, starting by warming up. Should just feel fairly nice, just like a gentle massage. And then go ahead and pick a sore spot and apply pressure there for about 30 seconds. So this works on the same principles as a deep tissue massage. It helps to decrease overactive or tense muscles. It can help you sleep at night as well. If you've got achy, sore muscles by the end of the day after a long day at work or a tough workout, you can help to relieve some of that tension by practicing your trigger point therapy. So one more area we're going to work on today is the tops of the shoulders, so the upper trapezius muscle. So we're going to cross over the body, over to the left shoulder using your right hand with a tennis ball. And same thing, we're just going to massage that upper shoulder and should feel fairly good at this point. Just looking around for any sore spots. And there I found one here, so I'm just going to apply pressure there for about 30 seconds. Something important to consider when using this trigger point therapy is that you can use this type of strategy, this therapy, on any muscle in your whole body. So your hips, your legs, your bottom of your feet, the back of your neck. The only rule here is don't press too hard that it's painful. And the second rule is just make sure you're not pressing on any joint or bone in the body. You want to focus on muscle. Okay, let's switch to the other side, same thing. Rolling around the top of the other shoulder. Massaging that upper trapezius muscle, and then go ahead and hold on a sore spot here. So this muscle often holds a lot of tension. So psychological stress will hold in our shoulders. If we have any type of job where we're reaching forward for most of the day, a lot of times we can start accruing a lot of tension in the shoulders here. So this is a great strategy to prevent injuries of the shoulders by allowing the shoulders to relax and make sure your shoulder joints are staying in proper alignment. So we're done with trigger point therapy for today.